Do you know anyone who has a drug addiction? I'm sure you do. Our country is experiencing an epidemic, and I believe the reason is because of doctors prescribing opioids much too often. If we compare ourselves to another country, such as Japan, it proves just how much we are going overboard with prescribing opioids. Japan has universal access to health care, which means more opportunities to prescribe, yet they are one of the lowest prescribers of opioids in the developed world. Every other country does at least as good or as poor of a job as we do managing pain while not using opioids anywhere near the same level. Right now, we are experiencing the deadliest drug overdose crisis in the U.S. history, and opioids are the root of this epidemic. How did it all begin? First, there were pharmaceutical companies wanting to make as much money as possible and marketed their drugs as safe and effective for treating pain. Then there were doctors. Doctors were receiving pressure to treat patients quickly and efficiently. Large integrated healthcare centers place tremendous amounts of pressure on doctors to practice medicine in a certain way. They want to get patients out in a timely fashion to be able to bill insurers at the highest possible level and to make sure that their patients were satisfied customers. Opioids were an easy answer to these two problems. In many cases, their patients were experiencing complex pain problems, so an easy response was to give pain meds. In many situations, doctors were simply prescribing way too much. With acute pain patients, doctors gave weeks or even months-long prescriptions, when only a few days' worth was needed. For example, if someone has their wisdom teeth pulled, it was common to give weeks-long supply of opioids. In reality, taking a strong ibuprofen for a week would suffice. Opioids pose more risk than benefits in most cases. They are only a good answer for a few chronic pain patients when prescribed carefully and on a short schedule. Looking at things from a patient's perspective gives some insight on this issue as well. The Institute of Medicine has estimated that about 100 million U.S. adults suffer from chronic pain. Patients should receive other treatment for pain, such as physical therapy or other natural approaches. Unfortunately, these options are out of reach for some patients. Insurance companies won't always cover these visits, and some people simply do not have insurance. As a result, the only suitable answers seem to be opioids. Sadly, America is now dealing with its deadliest drug overdose crisis, and doctors and pharmaceutical companies are largely to blame. Question?
What do you think an opposing viewpoint would be?
I believe that some people would argue that addiction is a disease. I don't necessarily think it's a disease until the person is already addicted and their chemical makeup in their brain changes.
Thank you.